Now to the latest on the coronavirus pandemic in Maryland. We're closing in on nearly 1,000 cases, but the number of people in the hospital continues to drop. Right now, only 470 people are hospitalized, the lowest total in months. And on this graphic, you can see that the overall percent of positive tests is dropping across the state. The state says it now stands at 3.49%. Despite the positive trends with these numbers, there are concerns about the weeks and months ahead if people don't remain vigilant. WJZ's live right now. Paul Gessler with details. Paul.
Hi, Vic. So Maryland is averaging about 9 COVID deaths a day so far in the month of August. That's slightly less than July, but doctors say the public should not let its guard down when it comes to this virus.
As Maryland reported Thursday its fourth highest day of testing volume, Governor Hogan announced Arkansas and Rhode Island are the latest states to join Maryland and others in an interstate testing compact in the absence of a national plan.
Making sure people have ample support in between, access to tests, to test centers. These are all things that are good to have everywhere.
Dr. Neil Roy of Sinai Hospital says the public needs to remain vigilant.
Young people are still dying fairly regularly. Just a 45-year-old person died a few weeks ago in one of our ERs, and there's young and healthy.
Public health officials warn an incoming flu season could compound problems.
This could be the worst fall from a public health perspective we've ever had.
Infections in Worcester County, home of Ocean City, increased by more than 36% the past 2 weeks, the highest by far statewide. Since July 30th, Essex cases spiked the most of Maryland's top zip codes. Infections in 21221 jumped nearly 30%. Doctors argue data suggests transmission is still strong.
And that usually happens from being out and about and socializing and not wearing masks and not hand washing and not distancing.
Dr. Roy says the mortality rate has remained high.
In March, when the talk of coronavirus first came out, the fear of coronavirus was here. The threat was probably here. Now I think it's flipped. People seem to be less afraid than they should be because the threat is just as high, if not higher.
Back live now, the Children's Hospital of Philadelphia warned this week of the risk this fall shifting back north in the I-95 corridor between Virginia and Boston and urged states to impose limits on gatherings. We're live tonight. I'm Paul Gessler for WJZ.